Today we are at Harrison Vein and Vascular Center. I am joined by Dr. Harrison and Lauren. And Dr. Harrison, tell us why someone would come and see you.
So I'm Dr. Harrison with Harrison Vein and Vascular. Patients come to see us, Lauren and I, if they have vein issues typically. In other words, if they come to us with heaviness or pain or swelling, then they'll come and see us because the majority of the cause is a vein issue.
There is a graphic behind us of some wounds, essentially, of what people can experience on their legs. Is this common that you see this?
Yeah, this is very common. So I'm going to stand up and show you. But patients begin with swelling, and that's nothing else, just swelling. And then they progress to staining of the skin. And then some may have varicose veins. And then they begin to have thickening of the skin and discoloration. And then some will progress to a wound like this. 30% of our patients that we treat have wounds. So we see a pretty fair segment of some pretty sick people. Nice thing about this is we know what causes these wounds, and we look for the cause. They're usually small perforator veins that are sending blood directly to the surface and cutting off the oxygen to the skin. So we get rid of that, and that's why our success rate in healing these wounds is 100%.
Wow.
100%.
That's amazing.
It
Lauren,
is.
I want to talk to you about treatment and the procedures. What does that look like when someone comes and see you? What's the next step?
Right. So first they are, they have their ultrasound performed, and so we know what specific veins need treatment. After we have that plan of care ready, we pull them back to a procedure room. They're sterilely prepped. We identify the vein on ultrasound. One of our ultrasound techs will map out the vein and mark it up for us. Then just an IV, like what you would have placed in your arm, is put into the leg. Pretty painless. We do a little cold numbing spray, but that's all you really need. A quick IV is placed into the leg. We elevate the leg to get the vein to shrink down in size, and then we inject it with a medication. So it's a very simple and painless procedure.
Where does that vein go? Is it still being used in the body?
No. So the medicine actually works, it denaturizes the endothelial lining of the vein, and so it's no longer a working vein. The blood is then rerouted to healthy collateral veins.
So this is not just cosmetic. This is truly somebody's in pain, somebody's experiencing these symptoms. What happens if they wait too long?
So this is a progressive and it's a chronic disease. So the body is not, you're not going to get better on your own. You need treatment. There's risks of without having treatment. Risks include DVT, like what my dad talked about with some of the wounds you see here, bad skin changes, heart disease, and even death if it's not treated.
And talk about how long does that procedure take, and then what does the healing process look like?
So the procedure only takes a few minutes. Probably the longest time is raising that leg up on a pillow and waiting for the vein to shrink down some. We want it to shrink because the medication that we inject in it coats the inside lining better if the vein shrinks down. So it takes a few minutes for that. And then we inject the medicine, lower the leg, we wrap the leg. The wrap stays on for 24 hours or so. The healing process begins immediately. Some patients feel better the next day. Some patients it takes a week or 2 weeks.
You were telling me earlier that some people, it takes years before they'll come in and actually seek help. So they're living with this pain or these open wounds before they come and see you. Is that correct?
Yes, absolutely. Lauren, I think probably we see patients that have had wounds for years before they come in. Not days or months or whatever, but years.
Why do you think that is? Do you think that they believe it's not treatable?
That's a good question. I would ask the audience, the people listening, why do you not come in and see us?
Yeah.
Well, partly because maybe they don't know about us.
That's the biggest.
Yeah. Or they're told by another family practice doc or another physician or an ER doctor, don't worry about it. It's probably just aging. It's not aging. It's not aging. It's chronic venous insufficiency. And if you don't believe me, go to ChatGPT and look up chronic venous insufficiency. And what do you find? That's what you find.
It's misdiagnosed a lot as cellulitis. People, I see patient after patient, they've been on antibiotics for cellulitis or even hospitalized. One patient had been hospitalized several times for IV antibiotics. And never got better because the primary culprit was never treated.
For more information, or if a viewer wants to come and see you, what's the best way to do that, Dr. Harrison?
So either call the number on the screen. That's probably the fastest and easiest. You can go to our website. It's harrisonvein.com. Just get in touch with us somehow, and we'll see you. In fact, we'll do a free ultrasound just to see if you've got the problem at all to even worry about. You don't even have to see Lauren or I. Just come in. Our techs will do a free ultrasound, and then at least you'll know.
Right.
Do I have vein disease or not? We don't treat it because of the ultrasound being positive. We treat you because you have symptoms and the ultrasound's positive both.
Dr. Harrison, Lauren, thank you so much for your time. I always appreciate it.
Ansley.
We'll have more Good Morning Arkansas after this.